আসসালামু আলাইকুম। আমন্ত্রণ রাজ টিভি হেলথ বুলেটিনে আপনাদের সঙ্গে আছি আমি সীমা জামান। শুরুতেই জানিয়ে দিচ্ছি শিরোনাম। বাংলাদেশ পেডিয়াট্রিক অ্যাসোসিয়েশন বিপিএ এর উদ্যোগে অনুষ্ঠিত হয়ে গেল 5th ইন্টারন্যাশনাল অ্যান্ড 21st বাইনিয়াল বিপিএ কনফারেন্স। চিকিৎসা সেবায় বাংলাদেশ এখন রোল মডেল বললেন স্বাস্থ্য ও পরিবার কল্যাণ মন্ত্রী জাহিদ মালেক। শুনছিলেন শিরোনাম, এবার বিস্তারিত। বাংলাদেশ পেডিয়াট্রিক অ্যাসোসিয়েশন বিপিএ এর উদ্যোগে বঙ্গবন্ধু শেখ মুজিব মেডিকেল বিশ্ববিদ্যালয়ের শহীদ ডাক্তার মিলন হলে 5th ইন্টারন্যাশনাল 21st বাইনিয়াল বিপিএ কনফারেন্স অনুষ্ঠিত হয়। 3 দিন ব্যাপী এই আয়োজনের প্রথম দিনে বাংলাদেশ পেডিয়াট্রিক অ্যাসোসিয়েশন এর সভাপতি অধ্যাপক ডাক্তার মোহাম্মদ শহীদুল্লাহ এর সভাপতিত্বে প্রধান অতিথি হিসেবে উপস্থিত ছিলেন গণপ্রজাতন্ত্রী বাংলাদেশ সরকারের মাননীয় স্বাস্থ্য ও পরিবার কল্যাণ মন্ত্রী জাহিদ মালেক। বিশেষ অতিথি হিসেবে উপস্থিত ছিলেন বঙ্গবন্ধু শেখ মুজিব মেডিকেল বিশ্ববিদ্যালয়ের উপাচার্য অধ্যাপক ডাক্তার কনককান্তি বড়ুয়া। অনুষ্ঠানে দেশ বিদেশের বিশেষজ্ঞ চিকিৎসকরা অংশগ্রহণ করেন। বিস্তারিত মেহেদী অর্ণবের রিপোর্টে।
বাংলাদেশ পেডিয়াট্রিক অ্যাসোসিয়েশন বিপিএর উদ্যোগে আয়োজিত 5th ইন্টারন্যাশনাল অ্যান্ড 21st বাইনিয়াল বিপিএ কনফারেন্সের প্রথম দিনের প্রথম অধিবেশন বঙ্গবন্ধু শেখ মুজিব মেডিকেল বিশ্ববিদ্যালয়ের শহীদ ডাক্তার মিলন হলে সকাল 8টা থেকে শুরু হয়ে চলে সন্ধ্যা 6টা পর্যন্ত। প্রথম দিনের অধিবেশনে সভাপতিত্ব করেন বিপিএর প্রেসিডেন্ট প্রফেসর ডাক্তার মোহাম্মদ শহীদুল্লাহ। প্রধান অতিথি হিসেবে উপস্থিত ছিলেন গণপ্রজাতন্ত্রী বাংলাদেশ সরকারের স্বাস্থ্য ও পরিবার কল্যাণ মন্ত্রী জাহিদ মালেক এমপি এবং বিশেষ অতিথি হিসেবে উপস্থিত ছিলেন বঙ্গবন্ধু শেখ মুজিব মেডিকেল বিশ্ববিদ্যালয়ের ভাইস চ্যান্সেলর প্রফেসর ডাক্তার কনককান্তি বড়ুয়া। অনুষ্ঠানে প্রধান অতিথির বক্তব্যে মাননীয় স্বাস্থ্য ও পরিবার কল্যাণ মন্ত্রী জাহিদ মালেক বলেন, স্বাস্থ্যসেবায় বাংলাদেশ এখন ভারত ও পাকিস্তানের চেয়ে অনেক এগিয়ে।
আরেকটি জিনিস আমি হাতে নিয়েছি, আপনাদের অ্যানাউন্স করতে চাই। আমাদের দেশে যেহেতু এনসিডি অনেক বেড়ে যাচ্ছে, আমি ইতিমধ্যে সিদ্ধান্ত নিয়েছি, মাননীয় প্রধানমন্ত্রী জানেন, আমি আইসিইউ এবং ডায়ালিসিস ইউনিট এবছরই আমি অনেক বৃদ্ধি করব। প্রায় আইসিইউ প্রায় 150 বেড থেকে 200 বেড সারা বাংলাদেশে আমি ইনক্রিজ করাবো এবং ডায়ালিসিস ইউনিট প্রায় আমি 300 ডায়ালিসিস ইউনিট আমি বৃদ্ধি করার পরিকল্পনা নিয়েছি।
অনুষ্ঠানে বিশেষ অতিথি বঙ্গবন্ধু শেখ মুজিব মেডিকেল বিশ্ববিদ্যালয়ের উপাচার্য অধ্যাপক ডাক্তার কনককান্তি বড়ুয়া বলেন,
who are working relentlessly to reduce mortality and morbidities of our children. Bangladesh Paediatric Association, since its inception in 1972, is exercising its professional commitment sincerely. Working with government and development partners, BPA is contributing a lot in national health system at every step, starting from strategic directions.
পেডিয়াট্রিক্স অ্যাসোসিয়েশনের কার্যক্রম তুলে ধরে অধ্যাপক ডাক্তার মোহাম্মদ শহীদুল্লাহ বলেন,
Till now, I have not used probiotics. Rather, I stopped all those babies who were taking probiotics and came to my chamber. So that's my practice here. Now, ladies and gentlemen, I will take you to a journey of child health. As a president of Bangladesh Paediatric Association, I was proposed that I give a talk live on this particular area. Now, but with a special emphasis or tagging importance to the quality of care. The reason being that we have been doing a lot of things, but perhaps this is the time that we should tag importance of quality care to the newborn and the child. So this is the outline of my presentation. I will briefly tell about the current situation of newborn health. Most of those figures and facts are known by you. But just in one particular slide, that we have achieved NDG, we are supposed to go to SDG by 2030, but so far the government of Bangladesh, with the advocacy from the professionals and the development partners, has made a target of 2022, where our target is to reduce the neonatal mortality rate to 18, and if we cannot do that, perhaps we'll not be able to reach the NMR down to 12 by 2030. This is the trend, and we all know the cause, 3 major killers, but I will suggest to draw your attention that preterm birth and its complication contributing to the highest. Next is intrapartum related events, that is birth asphyxia, then sepsis. But look at the figure of congenital birth defects. It was only 2% 30 years ago. But as we are reducing the other causes of newborn death, the congenital birth defects is rising. I'll share with you, in Sri Lanka, the number one killer of newborn is not sepsis, nor birth asphyxia, not preterm and complications, but congenital birth defects. Now, the time around birth is very critical. It is the first day where 50% newborn are dying, and by first week it is 80% plus. So, where to focus? To take care of the newborn? Day 8, day 9? No. The first day and the first week. Another issue is we are talking about ballo bibaho, adolescent pregnancy. It has been proven that adolescent pregnancy can lead to the maternal mortality and also increase newborn death. Look at the figure from 27 to 2040. It's encouraging that our adolescent or teenage pregnancy is reducing, but it's still quite high. It's still quite high. Now, as I said, few figures. Now I'll talk about some of the interventions that what we are doing now in our country. We have got level-wise service of essential service package, and we are very smart about that. The countries can boast about it. We have got community clinics, we have got Union Health Center and FWC, Upajila Health Complex, MCWC and district hospital. So there is bottom-up approach, but unfortunately the referral linkage, which should be bottom-up, is not actually effective or working in our country. So what can we do to prevent newborn from dying? It is nothing but just newborn health specific few interventions, essential newborn care, antenatal steroid to the mother who is going to deliver premature babies, neonatal sepsis management in the community level with a simple antibiotic, and specialized newborn care at district and sub-district level, because some of the newborn perhaps will be landing up into the hospital because of their major illness. So these are the priority interventions like essential newborn care, resuscitation, comprehensive newborn care package. I like to tell about comprehensive newborn care package. It has been developed in Bangladesh and being very much acclaimed globally, that this is a comprehensive newborn care package which can be offered from Upajila and downward, and that can save many lives. Then kangaroo mother care, possible severe bacterial infection management, and special care newborn unit in some hospitals. This is the essential newborn care practice. There has been some improvement, but still I'm not very happy, and perhaps you will not be also happy with this. Now, kangaroo mother care has been identified, proven a very effective means in reducing newborn death. We have got a champion here, Suki Mendoza, sitting in the from Philippines. She has come this last night, and she'll be giving a talk on that. So as I said, that this is very effective, but what are the challenges? I share with you because we are practicing, so we know our challenges. One is the dropout of trained personnel causes delayed implementation process. We train people and then they go out. Incomplete documentation of services in the register. We do KMC, give KMC service, we do not make a register. If we look at the very latest 2018 figure, so there has been some evidence in our country, and we are one of the leading country, and CIPRB, you have heard the name? CIPRB, Center for Injury Prevention and Research Bangladesh. And there, the playpen for children between 6 to 18 months, ওই যে টুনটুনি বা ঝুনঝুনি লাগাই দিলে 6 থেকে 18 বছর হাঁটলে মাটির পাবে যে অনেক দূর চলে যাচ্ছে। Achol is a nice program that I have seen in Norsingdi, where community creche, আমরা creche facility টাউনে বলিস, কিন্তু বলছে না, গ্রামেও যদি creche facility করা যায় তার একটা উদাহরণ আমি দেখাবো। Survival by swimming between 4 to 10 years, raising awareness of children under 18 years, modification of environment, and rescue and resuscitation and lifeguard. এইটা দুইটা আমাদের দেশের এভিডেন্স। এইটা হলো কমিউনিটিতে 80% প্রোটেক্টিভ। এই সময় মারা যখন রান্নাবাড়া করে তখন যদি বাচ্চাদেরকে একটা ক্রেশ মতো রাখে তাহলে এটা খুব কাজ করে। আর এটা হলো সুইমিং, ইট ক্যান প্রোটেক্ট 90% ডেথ ফ্রম ড্রাউনিং। So that's the success. I'm not sharing with you. Now, how we can prevent children from dying? What is our goal as a pediatrician? It's nothing, some child health specific interventions are there, and I think we know about it. I will not touch on that. Now, to the fact end of my presentation, I will share about the quality of care. So far, I have said about the interventions coverage. The whole world is running after quality of care. So I will be briefly discussing on that. It's a global priority. And from MDG, if we want to go to SDG, I tell you, if we do not use quality of care, we are not going to reach there. And 3 million lives can be saved per year for mother and newborn with care. And look at this figure. This particular quality care at the time of birth, and if you spend $1 for quality of care, you will get a return of $3, not $2. So we have to put emphasis on that. So there has been evidence to action, and look at this. Care at birth, universal coverage, and care of small and sick newborns. Kangaroo mother care, steroid, newborn resuscitation, antibiotics. Dimensions of quality care is about the safety, effectiveness, timeliness, very important, efficiency, equitable, people-centered. And I'm not going to touch upon this, but point of care, continuous quality improvement. It has to be always from pre-pregnancy, pregnancy, time of delivery, newborn, infant and child, and adolescent, sorry. That's the continuum of care. And what does it say about quality care? You do a plan, then do according to the plan, then study what you have done, and then act again. So that's called PDSS cycle. I tell you, historically, Navana company of Toyota, I think they began this thing and they made tremendous improvement. Then it has been converted into life science or health science as well. Look at the KMC's success with quality of care. There is a trained nurse, and if you can give proper care, KMC will be successful. Look at the possible severe bacterial infection. You have a doctor who is knowledgeable and skillful, can do a lot. So challenges for implementation is always there. So what is the role of the pediatricians? Now, it's me and you. Promotion of a culture of quality, building capacity within ourselves, the updated clinical standards and protocols, on-the-job mentoring and refreshers, work improvement teams, plan, do, check and act, accountability, regular supervision and monitoring, and measurement of quality. Role of the pediatrician, how to do all these things, we can do, and we have introduced one thing in BSMMU called EPIC. EPIC is evidence-based practice in improvement of quality. And look at this, there was a global, our mentors, they came, they trained us, and then this was a group work that was done. Then workshop was done in Bangabandhu, and this is the work activities done by us. I was a participant along with my resident and the nurses, and after the activities, we are now moving forward. So last slide that I want to say, way forward, is the strengthening of health system, increase financing for maternal newborn health, prevent early marriage and adolescent pregnancy, focus on preterm and small baby, ensure quality of care and quality of care at birth, mobilize parents, family and community, and strengthening monitoring and evaluation mechanism. And with that, I like to say that what I try to do, actually to share with you, to, what should I say, to inform you, to encourage you, to stimulate you, that let us do all work together with the emphasis of quality care. We can definitely able to reduce child death in our country. Thank you very much.
Thank you, Professor.
স্বাস্থ্যসেবার মান ক্রমেই বৃদ্ধি পাচ্ছে এবং এই মানকে আরও সমৃদ্ধি করতে বর্তমান সরকার সব ধরনের পদক্ষেপ হাতে নিয়েছে। অনুষ্ঠানে দেশি চিকিৎসকগণের পাশাপাশি বিদেশি চিকিৎসকগণও তাদের বৈজ্ঞানিক প্রবন্ধ উপস্থাপন করেন।
Countries with the greatest number of deaths per year among newborns, and India is number 1. Bangladesh, unfortunately, is still there as one of the top 10 countries contributing the greatest number of neonatal deaths globally. The Asia-Oceania region is a region composed of 62 countries. However, 52 of those countries are all in the developing phase. Only 10 countries are actually well developed. This region has been lumped together. If you look at the UN grouping and WHO grouping, you will see that this region has been put together as one region. And in the FAO countries, of which Bangladesh is an active member, the trends in neonatal mortality from 1955 to the current 2016 have shown that we have made progress in this aspect. Neonatal mortality, Bangladesh was number 1 in 1955 with the highest mortality rate. But you will look at Bangladesh now, if you follow the trend, you are now down to number 4 actually from the top. Bangladesh has made considerable progress in bringing down neonatal mortality rate. So in 2015, Bangladesh was number 3. In 2016, you're now in number 4. You are now even less than Nepal. You are now at 20 per 1,000 live births. Philippines has stayed somewhere in the middle, and we're always there. We have not made much progress. So if you look at trends, Bangladesh has made considerable efforts and outcomes in terms of bringing down neonatal mortality rate. In the Asia-Oceania region, we have the countries with the highest mortality, and that's Pakistan. And there we also have the lowest country, or the country with the lowest neonatal mortality, and that's Japan, also including Singapore and Korea. What causes newborn mortality? Earlier this morning, Professor Shahidullah already outlined the top three causes of newborn mortality. And globally, preterm birth and its complications still rank the highest, followed by intrapartum-related events and sepsis. The fourth being congenital abnormalities. But among countries, this differ considerably. Like prematurity, you will see that in Korea, their neonatal mortality rate is low, but majority of their deaths is due to prematurity. Bangladesh, your neonatal mortality is still 20 per 1,000, but due to prematurity is only like 30%. Intrapartum asphyxia is more common in China, and Bangladesh is around 22.7 per 1,000 live births. Deaths due to sepsis is quite common in Bangladesh as compared to other countries. And deaths due to congenital anomalies, on the other hand, is highest in Japan. So you will see Japan, even with its lowest neonatal mortality rate, its highest cause or the most common cause is congenital anomalies. So there are variable proportions or causes of neonatal or the hospital, but the moment they go home, so young pediatricians sometimes, they are, how do I do it? Oh, maybe I'll try and do it. I can do it. I will do it. And before they say, yes, I did it. So for us who are in the directorate or administrative role in hospitals or in pediatric residency training,
parents, you give this food, not only chaler gura and doodh. So if the doctor advised that is better. So that we have to do. And also the exercise. You know, our mothers are very eager to take the babies to the coaching centers for the tuition. But if we advise them, you must take the baby for any indoor or outdoor exercise or outdoor games. They must keep time. If they can keep time for the coaching, why can't they keep time for the children to take to the playground or outdoor or indoor, any type of exercise? So counseling to the parents is very important about his or her health, because without counseling, we can't achieve our next generation as a healthy, physically, mentally, emotionally healthy. Because you know what are the benefits of counseling? If we counsel the babies, parents properly, that will.
বক্তারা বলেন, এই ধরনের অনুষ্ঠান আয়োজনের মাধ্যমে স্বাস্থ্য খাতে দেশি বিদেশি চিকিৎসকদের মাঝে ব্যাপক জ্ঞানের আদান-প্রদান ঘটবে।
Leukemia, and more so with acute lymphoblastic leukemia. But this acute leukemia under 1 year of age is a different issue. So I thought that this will be quite pertinent to select this topic to address because it has a uniqueness and there are challenges as well. Please look at the girl. She's a 10-month-old infant. She has presented to us with fever for 1 month, reduced playfulness and bleeding. On examination, she was found to be pale, febrile, and there was skin bleeding with leukemia cutis.
Among these, CNS disease was the highest. It is around 42%, followed by arthritis. It was 33%, and autoimmune hemolytic anemia and thrombocytopenia and serositis also found in this cohort.
And according to severity, this table show that more the severity of asphyxia, more prothom-in-time epithet entity. And outcome were 82 patients survived, death were 13 and DRB was 5. So asphyxia predisposes to coagulopathy in newborn. This study concluded that prothom-in-time epithet and TT were significantly more prolonged among babies with severe asphyxia than with moderate asphyxia.
They are so aggressive in the marketing. I will not be surprised if there is a 10 sponsor for this meeting who are making the probiotics. Regulation problem, that most of the time probiotics are licensed as a food supplement. Now there is a difference between the food supplement and drugs. If you want to launch a drug, you have to go through this severe scrutinizing as far as efficacy and side effects. But that is relaxed when you are using as a food supplement, and most of the cases probiotics are marketed as a food supplement and they are promoting as a drug without following the strict.
So what do we mean by acute leukemia in infancy? It is kind of acute leukemia below 1 year of age in general. So, if you kind of classify acute leukemia below 1 year of age, that is infantile leukemia, broadly we classify into infantile acute lymphoblastic leukemia, infantile acute myeloid leukemia, and infantile leukemia unclassified with mixed lineage as well. So, my topic or my title is Infantile Leukemia, a unique entity with its challenges. You see, I have earlier mentioned the term infant leukemia is generally referring to acute lymphoblastic leukemia or acute myeloid leukemia, which is diagnosed before 1 year of age. There has been no data as such in global perspective because it is quite rare.
বেঁচে থাকলে হয়তো আমাদের আরো ভালো লাগতো। তো যাই হোক, ভদ্রলোক যতদিন বেঁচে ছিলেন একটা ভদ্র মানে তাকে কোনোদিকে আমি ছোট করতে পারবো না, তার সহকর্মী হিসেবে আমি সবসময় পাশে পেয়েছি এবং শুধু এই ফিল্ডে না।
Usually they say like this, and these are self-adhesive NIRS sensors. After they are attached, they are connected to the monitor via a proper cable. Now this is the screen of NIRS monitoring. You can see these are the recordings. This is in left side and this is in right side. This is one particular type of company monitor. There are many other monitors available. And this is the trend of this NIRS or regional cerebral oxygenation monitoring. Now what is the technique utilized? As you can see, if you turn the sensor, this is a self-adhesive sensor. There is an emitter, there are 2 photo detectors. These are all known as optodes and they are separated by distance of around 4 to 8 centimeters.
সন্ধ্যায় এক জমকালো সাংস্কৃতিক অনুষ্ঠানের মধ্য দিয়ে প্রথম দিনের অধিবেশনের সমাপ্তি ঘটে। অনুষ্ঠানের মিডিয়া পার্টনার হিসেবে কাজ করে বাংলাদেশের প্রথম মেডিকেল ভিত্তিক অনলাইন টেলিভিশন rajtv। এবং এই অনুষ্ঠানটি বঙ্গবন্ধু শেখ মুজিব মেডিকেল বিশ্ববিদ্যালয়ের শহীদ ডাক্তার মিলন হল থেকে সরাসরি সম্প্রচার করা হয়। মেহেদি অর্ণব, rajtv, ঢাকা।
দর্শক, rajtvর হেলথ বুলেটিন এই পর্যন্তই। আপনার মেডিকেল কলেজ, হাসপাতালের গুরুত্বপূর্ণ ঘটনা, সায়েন্টিফিক সেমিনার, সিম্পোজিয়াম এবং কনফারেন্সের খবর আমাদেরকে জানান। rajtvর হেলথ টিম পৌঁছে যাবে ঘটনাস্থলে। এতক্ষণ সঙ্গে থাকার জন্য ধন্যবাদ।
You are watching rajtv, জাগরণে বাংলাদেশ। Please subscribe our channel.